All right, looking good. Good afternoon, everyone. Thank you for joining us for Mental Health Colorado's Legislative Lunch Break webinar series. I'd like to start by thanking our sponsors for our 2026 Brainwave, Rocky Mountain Health Plans, Accessitree, and Johnson & Johnson for supporting this webinar series. Today is January 30th, 2026, and this is the first instance of our Legislative Lunch Break webinar series. We will continue to share bi-weekly updates about what's happening in mental health policy at the Colorado State Capitol and ways that you can get involved. So my name is Ashley Prowlis. I'm the Senior Manager of Development and Operations with Mental Health Colorado and your host for this program. And with that, I'll pass it to Vincent.
Hi, good afternoon, everybody. I'm Vincent Atchity. I'm the President and CEO.
Hi, everyone. I'm Wendy Buxton Andrade. I'm the Vice President of Government Affairs. Thank you for joining us.
Yeah, just a few framing words overview. Most of you are familiar with our work, but have been working in Colorado since 1953, and we work to pass laws, change practices, and build a movement promoting healthier minds across the lifespan for all Coloradans. Each legislative session, as bills are introduced, we start formulating a platform of bills across the lifespan that we use to educate elected officials and voters about the complex world of behavioral health, so that people understand that we eagerly want support for individual bills, true mental health champions understand the complexity of the landscape and are supportive of the complete platform that we represent across the lifespan. Each week, we will update you with bills as they're heading toward committee. So not all of our focus areas will be included in each week's updates. That is out of our hands in terms of how bills make their way through the process of becoming law at the Capitol. So the first bill we want to bring your attention to, which we will do repeatedly over the course of coming weeks, is our key priority bill, Senate Bill 60, which was just introduced earlier this week. And this is about focusing on the mental health of young athletes. Wendy, do you want to say a few things about this bill?
Sure. Just so you guys know, this is coming down the pike to be in committee the 1st of March. So this is not a immediate action bill, like some of the others we'll cover today. But this bill is our youth athletic coach mental health. It teaches mental health to coaches of how to spot mental health in children that they are coaching, as well as the way that they practice coaching and coach youth, how it can affect a child's mental health. This also has a protocol on it that once a child has gone through concussion protocol and it is determined that they have a concussion, that the coaches just alert the guardians that there could be a mental health issue and to make sure that their eyes are on their child that has had a concussion.
Yeah, in the spirit of our broad communications and public education work that's beyond the scope of the work at the Capitol, this bill is particularly exciting for us to work on because it gives us an opportunity to make sure that the public are well aware about the risks that young athletes may face across their uh, development toward adulthood, and acknowledge a couple of things. And one, that youth athletics are such a cornerstone of well-being for so many kids and a real opportunity to support healthful development and healthful outcomes. And yet, everybody ought to be better aware of the red flags of concern that may arise in the course of athletic competition. Um, so, this is a good one for us to keep bringing your attention back to over the course of coming weeks. Also in the area of focus, which is our Strong Start for All Children and support for children and families, we're excited to be supporting House Bill 1024, which is raising the age of voluntary relinquishment of a child after birth. Currently, the law stipulates that postpartum individuals may relinquish their children to a safe haven type site like a fire department or other similar safe haven sites within 72 hours after birth. This bill extends that frame of time from 72 hours to 30 days.
And just so you know, many of the women that or people that are having childbirth have crisis after the 72 hours. They're not even out of the hospital yet. And the 30 days goes with national standards and what other states do. So this is bringing Colorado in alignment with all the other states.
So in the spirit, one of our key areas of focus across the lifespan is timely access to housing, healthcare, supports, and services for earliest possible identification of needs and access to appropriate supports. A couple of the bills that have our attention already this year are Senate Bill 31, which is about access to certain controlled substances. And what this bill, known as a trigger bill, does is it keys Colorado law to federal FDA approvals and scheduling so that as at a federal level, substances are approved for therapeutic use, Colorado automatically adopts that access and makes them available to for therapeutic purposes here within the state of Colorado.
And I think you said it best.
All right. Well, then the other one we'll mention is Senate Bill 8, and this is about adult mental health access. This is a bill in the spirit of I Matter Colorado, which was passed into law initially as a pandemic response, which created greater access to care for Colorado youth by creating an online portal whereby young people could participate in an online assessment of their condition, which would then lead to access to 6 um, therapy encounters without charge and without diagnosis, thereby opening the pathway to accessible care for young people. So this bill aims to extend that similar framework of practice to adults so that we're broadening the pathway to care for adults regardless of their insurance status.
And so this is just the iMatter expansion for adults, and we are making sure that care for across the lifespan is acknowledged.
Well, a few things about House Bill 1039, adding municipal jails to county jail oversight. Over the past few years, Colorado has taken some significant strides in improving standards within jails. Colorado hosted its first jail standards commission over the course of the past couple of years and issued jail standards for county jails recently for the first time in its history. This bill stipulates that municipal jails be similarly accountable to the same set of standards for jails. And as the intersection of mental health and criminal justice is so important for the health and well-being of the people, it's very important to acknowledge that conditions in jails can be extremely deleterious for people's health, and that taking steps and measures to protect health and well-being in that incarcerated context are super important. Another key element of this bill worth paying attention to is protections for people who are pregnant or going into labor while incarcerated. This bill stipulates that every possible recourse be taken to make sure that people are not delivering children in jail settings while shackled or restrained. So there's important protections in place there.
And I think that it's just a good to add that municipal jails and county jails need to mirror each other. And your rights in a municipal jail and your rights in a county jail are exactly the same. And that's why we support this is because it does not matter where you go to be incarcerated, the standards need to be the same.
And just to mention this, as with many bills, it's aspirational to a certain extent because not all county jails are as readily able to meet jail standards as one another based on their capacity and resources. Municipal jails similarly are likely to be literally all over the map with regard to their capacity. And so there may be implementation hurdles to overcome. But just because there are hurdles to implementation does not mean that we as the people should not be aspiring for evenly accessible standards across all our systems and settings.
Next one, 10.
10.
1064 Youth for Offenders System Update. This strengthens the trauma-informed care, family engagement, and reentry support, focusing on the rehab and long-term stability. Of course, we want to make sure that the family engages in everything that the youth is doing and make sure that we have supports around our youth as they come out of the system and making sure that they do not have, as I call it, the hamster wheel of going back into the system because they do not have the supports. And maybe in long term, we can keep them out of DOC and as an adult offender. So this is something that we definitely support. We want to make sure that people get the support when needed and that they do not fall off the system after they are out, and making sure that it's a long-term stability.
Yeah, one of the main objectives of this bill is to ensure that there is an open road, a more open road for young offenders to be supported in their judicial process through a youth setting as opposed to an adult setting whenever possible, because those youth settings are far more favorable to more healthful outcomes as they re-enter the community.
One of the things to note on this bill, it expands certain procedural protections for system participants with mental or behavioral health conditions or intellectual or development disabilities to make sure that they receive the proper care. Thank you. These ones, as you know, our 32nd annual Legislative Education and Advocacy Day is coming up March 4th, and we would like to invite everybody to come. It starts at 7:30 in the morning. With advocacy training, we do have scheduled a few of our senators. They've already responded that they would like to stop in and be part of that day. So we will have that. We'll have expert panelists and a keynote speaker during that day. We will walk to the Capitol and introduce many of our participants to their legislators and see how the process works. So if you have not done so, please make sure that you register now for that. We also have the Colorado Suicide Prevention Advocacy Day. This is much of the same of what we happen at our lead, but it's focused on the Suicide Prevention and Advocacy Day, and it's hosted by a few of our collaborative people that we are constantly working on bills with and making sure that we are aligning and bringing awareness to suicide prevention. And Ashley, do you have anything that we missed on that or
And just
Vincent?
and just to point out that if you're not familiar, those square objects in the right are QR codes, and if you point your camera at those, it'll take you to the registration link for both of those sites.
That was going to be my notes as well. Thank you, Vincent.
Do we have another next step slide, Ashley?
Um, looks like it's that one and this one. Yep.
Um, Here we go. This is what we wanted to get to. So if you're here today, chances are you've already joined our brainwave. But if you haven't, please use that QR code to do so, so that you are kept fully in touch as we make our way through the legislative session. The other key thing we're going to be asking you to do over the course of all these upcoming weeks is to contact your legislators. And we've got a very handy system for doing that. If you use that other QR code there to the left, you'll be able to use your zip code to identify who your representative officials are if you don't already know, and reach out to them with a message in support of or opposition to bills on which we're taking positions. It's really important that your legislators hear from you. State government is a small world. And so when a legislator gets 30 emails about a specific bill from their constituents, that is like a five-alarm fire for them. It's a very different world than advocating at the federal level, where your voice may be drowned amongst the millions.
And just so you know, all of the bills that we referred to today are scheduled for committee in the next 2 weeks. So every 2 weeks, we will highlight bills that are getting ready to go to committee right away. So right now is your action time to contact your legislators on bills that we talk about, and make sure that if you have questions, concerns, or comments about the bills, now is the time to activate those letters to your legislators.
And on that final bullet there, the note about amplifying trusted information, Mental Health Colorado is a nonpartisan organization. The bills we support have bipartisan support. Commitment to the health and well-being of Coloradans is something shared by all sensible parties, regardless of their political identification. And your help in amplifying trusted, reliable, nonpartisan information that's good for the health of the people can't be underestimated in terms of the impact that that will have on our health of mind across the lifespan.
All right, so we've come to the end of our presentation. If you have any questions that came up throughout the webinar, you can email me at aperales@mentalhealthcolorado.org. If you haven't already signed up for our Brainwave, then this is a good place to start as well. And then I will email these bills to the Brainwave Network and offer ways that you can get involved in advocacy. Any final thoughts from Vincent and Wendy?
Yeah, please don't hesitate to reach out with questions. We will address your questions in upcoming webinars 2 weeks from today.
Sounds great. Thank you, guys.
Thank
Appreciate
you.
you all joining us today.
Yeah, thank you so much.